Okay, University of Cordilleras College of Nursing. This is your integrated management of childhood illness, IMCI training, and the set of slides that will be presented were prepared by Ma'am Juliet Avena, our clinical coordinator for the University of Cordilleras, level 234 ang handle niya. Okay. Okay, so the IMCI, as we said earlier, is a system created, okay, to make it easier for us to carry out some of our responsibilities in the community. And the IMCI chart booklet was formulated by the World Health Organization, UNICEF, okay, in order for facility workers, health facility workers who do not have doctors, kulang sa manpower, kulang sa facilities, to at least be able to give, okay, critical services, critical assessment, critical classification of patients, especially sa mga children 2 months and below, 5 years old and below. Okay? The IMCI chart booklet. So this is the 2015 edition of your IMCI chart booklet, and this is what I want you to get in the SLU bookstore as early as possible. Okay, so pumunta na kayo. Meron na ba dito sa classroom nyo, dito sa group nyo, ang may IMCI booklet or chart? Janice, Victoria, sino na ang may IMCI manual? Yes, Victoria Chan already has.
Wala po sa amin.
Yes, yung mga wala pa, kumuha na kayo kasi gagamitin nyo rin naman to until 4th year, or if you become community health nurses, you will need this. Kung wala pa, you have to familiarize yourself kung matutuloy yung face-to-face natin on Saturday. I haven't checked the calendar kung naka-assign yung group nyo for Saturday, but anyway, you have to, for the 3rd day of the presentation or RD natin regarding IMCI, I won't let you use the PDF copy. I want you to use the manual. There are 2 copies already, 2015 and 2019. So the latest edition is 2019. But according to the protocol or according to the orders of Mamagwilang, okay, we are still going to use the 2015 version. So in front of you now is the 2015 version. So yan yung mabibili nyo sa St. Louis bookstore for around 200 pesos, 250 or something. Basta hindi lalampas ng 300 pesos yan. So if you want a reason to get together with your group mates, okay, so para may rason kayong lumabas, get together with your group mates, or magkita-kita, mag-usap-usap, of course with social distancing and with your mask on since vaccinated naman kayo. If you wanna, kasi yung reason kaya kayo nabu-burnout sabi nyo hindi kayo lumalabas. Okay, puro kayo nasa online Zoom meeting lang. Okay, so as a group, if you want to go out, okay, one reason for you na pwede magpaalam sa mga parents nyo is you need to go to SLU to get a copy of your IMCI booklet. Okay, so hingi kayo ng, so if the booklet is 250, so hingi kayo ng 350 para may 100 kayong pambili ng milk tea. Okay, so this is your IMCI chart booklet. It's around 75 to 73 pages. Okay, and this manual is what we are discussing in our topics for today. So how do we use it? Okay, so this is the Philippine version, January 2015. We already have the 2019 version. Okay, but for UC standardization purposes, we are still using the 2015 version. Okay, the Childhood Integrated Management Integrated Management of Childhood Illnesses by Ma'am Avena. Okay. What is the IMCI? The IMCI is a clinical guide. Okay. The IMCI clinical guidelines are based on the following principles. Okay. First, you have to be able to assess or identify if there are danger signs, okay, in the child. And later we are going to identify what are those danger signs dun sa initial assessment natin. But if danger signs are present, it simply means that the child has a very severe disease. Okay, some of the danger signs that we will be able to assess in our patients is lethargy or unconsciousness. So you will see in the videos that I will be showing you tomorrow after our assessment review. Okay, so how does lethargy or unconsciousness look? Okay, there are times na iniisip natin pag nakapikit yung mata, unconscious. But tomorrow in the videos that you will be seeing, kahit nakabukas yung mata ng bata, pag unconscious siya, he is not responding. Vomiting is a danger sign because of course mas increased yung fluid and electrolyte imbalance ng bata. Yung malnutrition ng bata is increased when the child is vomiting. We are talking about infants 2 months and below or kahit below 1 year old ang IMCI. So inability to drink or breastfeed is a danger sign. Okay? It can cause death to the child very fast pag hindi intake yung child ng breast milk. Okay, so hindi yan gaya ng mga 5 years old and above na pag ayaw ng milk, okay, they have alternative food. Ayaw nga ng milk pero gusto naman ng fried chicken. Ayaw ng milk pero at least nakakain pa rin ng cookies or noodles. Okay, so for infants, especially those 1 year old and below, very dependent on breast milk. So if the child is not able to breastfeed in 2 hours, if the child is not able to breastfeed in 4 hours, 8 hours, okay, that is a danger sign already, and there will be a need, okay, to force fluids in the child. It can be through force feeding, IV, okay, depende sa intervention. Another danger sign is your CNS problems causing convulsions. Pag nagkukonvulsion, your patient is seizuring, okay, seizuring up, it is a danger sign, okay, and there is a need for immediate medical attention. Second thing that we have to assess in our children, okay, using the IMCI, is the children and infant are then assessed for main symptoms. Okay, so the main symptoms come if the danger signs are not present. So what are the main symptoms? Cough or difficulty of breathing. So these are the things that we will learn to assess. Diarrhea. Again, when we talk about diarrhea, still fluid and electrolyte imbalance because masyadong mabilis yung peristaltic activity, yung GI tract ng bata masyadong mabilis that it doesn't have time to absorb the fluids and nutrients. Okay, so tinatayin niya agad. So further malnutrition, hindi niya na-absorb yung nutrients. Okay, what else? Pati fluids. Okay, so further dehydration. Fever, an increase of temperature. Okay, and ear infection. So usually pag fever, it can mean that there is a systemic infection. Okay, so pwedeng because of a virus, because of a bacteria. Ear infection also. We are very careful with ear infection in children. Okay, again, if you talk about IMCI, 5 years old and below, 2 months and below. So pag ear infection, it is not really automatically life-threatening, but ear infection is the #1 cause of deafness in children. And pag napabayaan, okay, the ear infection can spread. Okay, so the different parts of the body. So nearest to the ear, of course, aside from the parts of the ear, okay, mechanisms of the ear, what can be affected is the brain and the brain stem kasi very close yung tenga natin sa brain stem and sa brain natin. So it can lead to death because of an infection that starts with the ear. Okay, so these are main symptoms. If the danger signs are not present, we go to the main symptoms. Okay, again, the emphasis is assessment for 2nd years. Okay, how do we assess that the child is having cough or difficulty of breathing? How do we assess that the child is vomiting? Ano yung nakikita natin? Okay, hyperemesis. How do we know if the child is experiencing lethargy? Convulsions. So yun yung mga kailangan nating malaman as 2nd year students. What are the signs of convulsions? What do we assess if the child has inability to drink or breastfeed? Okay, malakas ba yung pagsak ng bata? Tama ba yung position ng lips ng bata? Okay. Other factors can be is the child bottle feeding instead of breastfeeding. Okay. Advantage probably of bottle feeding is we can measure the amount of input of the child is drinking, but kung breastfeed yan, medyo mahirap tayo mag-assess. So there's other things that boils down basically to your assessment skills. Okay. How do you assess for diarrhea? Okay, so is there just when you talk about diarrhea, is it only positive and negative? Is the patient has diarrhea? The patient does not have diarrhea. Does it end there? Okay. So we have to consider the amount of the stool, the frequency, okay, the appearance of the stool. Okay, fluidy pa siya? Is there blood? Is the solid components green, black, red? Okay, so iba-iba ang kailangan nating i-assess. And infection. How do you assess for ear infection? So yun yung mga kailangan nating malaman. For young infants, when we say young infants, 2 months and below, so we have to identify if the child is experiencing local bacterial infection, diarrhea, and jaundice. So when you say jaundice, what organ is affected? Of course, the liver already. Okay, so it is because the liver is malfunctioning, hyperbilirubinemia. Okay, so different factors. In addition, all sick children are routinely assessed for. So we're talking about community setting. So as much as possible, we would like the children in the community, the parents of the children in the community, to let their kids be assessed at least once a month. Okay, so routine. Sabi nga natin, continuity and regularity of checking, okay, is part of prevention or early detection. So in addition, for IMCI, all children are routinely assessed for nutritional and immunization status. In terms of nutritional assessment, we are going to assess the children if they are properly nourished, overly nourished, or poorly nourished. Ang malnutrition natin is overly or poor. Okay, so not because mataba is properly is hindi siya malnourished. No, pag mataba is overly nourished, so it is still considered malnourished. So how do we assess that? It can be the weight, okay, weight to age ratio. Okay, it can also be a height to weight ratio, depende sa age ng bata. Okay, so aside from nutritional assessment, immunization status. Okay, so we are talking about children 5 and below. What are the vaccines given during birth? What are the vaccines given before the 2 months? Okay, what are the boosters and vaccines given from 6 months to 5 years old? So immunization status, are the vaccines complete? Okay, are the boosters complete? First dose, second dose, etc. Okay, so kailangan they are assessed for that. Okay, and they're given the proper schedule of vaccines. Okay, again, we will be discussing, since IMCI includes African countries, so HIV, okay, will be discussed. Okay, included yung assessments sa HIV. Pero sa Philippines, hindi ganong kataas ang cases ng HIV sa children 5 and below. But mind you, I think the news came 2019 or 2020. Okay, so sa buong mundo, bumababa ang cases ng HIV. But only in one country, of course, that is the Philippines, tumataas ang cases ng HIV around 2018, 2019, 2020. And why is that? It is because of the lifestyle of call center agents, BPO. Okay, so promiscuous sexual activity, okay, so premarital sex, etc., etc. So yan, tumataas ang cases ng HIV sa Philippines. So I don't know the updates on that kung 2021, kung na-regulate na nila or they were able to control it. Okay? But in your IMCI, since some countries targeted by IMCI like Africa, okay, so mataas yung HIV cases nila in infants kasi yung mga, what we call this, probably when the children are born, they already have HIV. Okay, so HIV is included in your IMCI. But there will be times that I will be skipping, okay, the HIV part, especially in the assessment. Sometimes it is expected in the IMCI that we have HIV testing kits in the rural health center, which is not applicable in the Philippines. Okay, other potential problems we also discussed. Okay. A concept in your IMCI is, as I said, we are going to prescribe and give medications, okay, limited medications, which is not normal, okay, because it is not our independent nursing intervention to give and prescribe medications, to prescribe medications and to give medications without a doctor's order. But through the IMCI system, we are given limited number of clinical signs used, okay, selected on the basis of sensitivity and specificity, okay, specificity to detect disease and to treat disease. Okay. If you open your IMCI manual, okay, so you can open sa PDF form ko. After assessing, okay, once we check the signs, we are now to, after assessing, we are now to classify the patient. Okay, so we are going to assess the fever, we are going to assess the cough, the breathing patterns, there is seizure, etc., etc. And based on the assessment, the patient will fall into 3 categories. Okay, based on sa assessment natin, the patient can be purple, the patient can be classified as yellow, or the patient can be classified as green. So this is your classification system in your IMCI. Okay, so based on your assessment, if the patient falls under purple, okay, so for example, there has been fever, there has been severe diarrhea, your patient can fall under purple. Okay, so tumatae na yung bata ng 3 days, like 10 times a day, etc., etc. Okay, so there is urgent pre-referral treatment and referral. Okay, it means that if your patient falls under purple category or purple classification, there are some interventions that may be done, okay, to stabilize the patient first in the community setting. Then, as soon as possible, we are going to transport the patient to the nearest hospital. Okay, bakit? Because it is in the hospital that critical care can be done for the patient, or emergency care can be done for the patient. Okay, so that is after assessing, the patient falls under purple. After assessing also, our patient can fall under the yellow category. Okay, so under the yellow category, kumbaga, this is your OPD, outpatient patients or outpatient services. So what happens is the patient is not really referred to the hospital. Okay, there are medications that can be given and can be administered in the rural health center. Okay, and the patient can continue treatment at home. Okay, so pwedeng umuwi, hindi kailangan dalhin sa hospital pag yellow. Okay, so siguro every 2 days, every 3 days, na ibabalik yung bata sa center para ma-assess, tapos binibigyan siya ng medication, aside from the medications that are being given at home. So purple means hospital, initial treatment at the center, then go to the hospital. Okay, sa yellow, initial treatment at the center, then you can go home already and go back for regular checkups, okay, within the week, within 2 weeks of treatment. Okay, lastly, after assessing, our patient can fall into green. Okay, the least critical. Ibig sabihin, it is not life-threatening. In the case of the child, is not life-threatening, and if there are signs and symptoms present, it can be treated at home. Okay, so those are the different classifications of our patients using the IMCI system. The patient can be purple, yellow, or green. Purple is urgent pre-referral treatment to the nearest medical facility. Yellow, specific medical treatment for advice within, okay, the clinic, and then can be continued at home. Sa green, specific advice will be given and home management will be done. Okay, so that is our IMCI system after assessment. Use a limited number of essential drugs. Sabi ko nga, okay, so dito pala dapat yung sinabi ko kanina. There are some medications. Okay, so nurses and the midwives are not allowed to prescribe medications, but through the IMCI system, there are some medications that we are allowed, a limited number of essential drugs, antibiotics, anti-inflammatories, respiratory dilators, etc. Okay, so again, for the treatment, if you go back to the last slide, if the patient falls under purple treatment, then ibibigyan natin sa kanya. If the patient falls under yellow, there will be also a list of interventions in the yellow category that will be given, and so with the green. Okay? So usually pag purple, dyan papasok yung mga medications na sinasabi natin. Initial medications to be given within the clinic or health center. Then the medications can be continued in the hospital. Pag yellow naman, the initial doses will be given in the clinic. Then the succeeding ointments, medications can be continued at home. Simple advice on home management, siguro minsan walang medications na pag sa green. Okay? So there is a use of limited number of essential drugs. Okay? After giving instructions on medications, after assessing, okay, so that's not enough that we've given medication already to yung bata. Okay, so no, the last part of your IMCI or one of the last parts of your IMCI is counseling the primary caregivers regarding the home care of the child. So we have to teach. Okay? Teach the mother, teach the father, teach the grandmother how to continue, like instructions on what to observe with the child pag inuwi na siya, instructions on the dosage of the medications, okay? Instructions on how to feed the child. Okay? So that is where counseling is given. A maternal and child concept regarding this, okay, is what you call the mother concept. Okay, the mother concept is a very important maternal and child concept. It means that in order for the mother to take care of the child, siguraduhin natin that the mother is well taken care of. So we also have to assess the mother kung wala siyang sakit, kung mentally, physically, emotionally she is stable. Okay, she doesn't have, wala rin siyang sakit, wala siyang iniinda. Okay? So kung walang sakit yung nanay, walang ubo, etc., walang fever, okay, it is easier for her or she will be more effective in taking care of the child or doing her role as a mother. Okay, so we have to mother the mother. So who will mother the mother? Sino mag-aalaga sa mother? Of course, una mag-assess dyan are the nurses. Dapat nakikita natin na everything is okay with the mother. Second, of course, the husband, sino pa yung grandmother, yung nanay ng nanay, yan nakikita niya na dapat na alagaan yung mother. Okay, so because she will be more effective in carrying out her obligations if she is healthy. Okay, so counseling also of the mothers and the primary caregivers. Counseling of mothers, what can we do, or our caregivers? Feeding and fluids, the proper time for breastfeeding, proper amounts if giving oresol, for example. Okay, when to return to the clinic. Okay, so later in your IMCI or tomorrow as we go through the IMCI, we will see what are the cases. Okay, we have to tell them, for example, the follow-up checkup can be 6 to 7 days from now. But when to return immediately is when your child starts to display difficulty of breathing. If the fever shoots up, okay, so when the patient was in the clinic, nasa 37, 38 lang. Pero inuwi mo, naging 40 yung lagnat. Okay, so this is when you immediately return to the clinic. Okay. When to return for follow-up, okay, if there are no, if the child's condition is improving naman, okay, pero hindi pa rin natin papabayaan, okay, we will sometimes schedule the case for follow-up checkup. So that's the difference of when to return to the clinic as soon as possible. Okay, if we are observing that the child is not improving, develops added symptoms that are danger signs, okay, soli agad sa clinic. Pero kung wala naman, if the child is improving, okay, the child will also return for follow-up. Okay, so yeah, as a review, nakita nyo na to kanina, what are the steps in your IMCI? And I will keep on reiterating this. Okay, being second-year students, we will be focusing on the first step, which is assess. The head-to-toe assessment, vital signs assessment. Okay, so ito yung magiging focus natin dun sa IMCI, the vital part. Assessment. Okay, so what are the things that we are going to assess? Sabi ko kanina, always check for danger signs first. Actually, meron pa tayong iunang i-assess dito eh. You have to assess the age of the child. Okay, because your IMCI booklet is divided into two parts. Interventions for 2, interventions and assessment classification for 2 months and below. Then the second half is for 2 months up to 5 years. Okay, so first thing we assess is the age. Second thing we assess are the general danger signs, unconsciousness, lethargy, vomiting, yung mga nakita nyo kanina. Convulsion, unable to drink or breastfeed, vomits everything or vomits half of what is breastfed. Hard to rouse, so hindi nagigising. Okay, so it means that the CNS is already affected. Either oxygenation sa brain, kulang na yung nutrients sa utak, kaya ang hirap gisingin. Okay, very severe disease and local bacterial infection. Okay, so there is swelling, may sugat, okay, may infected wound, okay, that is your local bacterial infection. After assessing, after gathering data, okay, the second step is to classify. Okay, urgent pre-referral, pag purple, yung classification natin. Specific medical treatment advice, pag yellow. Simple advice on home management if green. We are going to classify the patient because after classifying, that is when we will identify the treatment also. So you can see here, okay, pag purple, okay, purple din yung interventions na nakalista dyan. Specific medical treatment for yellow and green treatment for step 3. Okay, so sinabing treat, kaya nakasulat dyan usually is the different okay, after identifying the treatment, after identifying what list of treatments are going to be given, of course, we are going to do the implementation or the treatment already. Okay, so give oral medications, give instructions to the primary caregiver regarding the medications. Okay, so yan yung mga gagawin natin as treatment. Okay, counsel. After giving the treatment, okay, we are going to counsel the primary caregiver, the mother, the father, the grandparents. Okay, so we have to assess, are they stressed? Okay, parang yung mga students ng UC and SLU, stressed na ba kayo? Okay, so what are the things that we can guide them with? Okay, so proper breastfeeding, adjustments regarding nutrition, time management, etc., etc. So, of course, since these are especially sa first-time mothers, it's really stressful for them. Okay, so it's a lot of educatives and counseling. Okay, and of course, step 6, follow-up checkup. Follow-up checkup is when they come back for treatment and when they have to come back if danger signs are observed. Okay, so here, dito ang itsura ng IMCI nyo. It is classified in what to assess, how to assess. We classify. Okay, so what are the classifications to know if the patient falls under purple, yellow, or green? Okay, the treatments are listed already and we are just going to implement. We assess and classify, then identify treatment, then implement. Okay, so treat. So treat the child. Okay, doon sa listahan ng treatment natin, give oral medications, give paracetamol if there are fever. Okay, since it is a manual, nakalista doon. Okay, so teach the mother to give oral drugs at home. Okay, so when there are instructions there to be given. Counsel the mother. Okay, so we will browse through your IMCI manual. We assess the child's feeding. Okay, so if it is an instruction manual, as I told you, even the questions to ask during the assessment will be written. How do you breastfeed? For example, like counseling the mother, how many times a day? So ideally, at least every 2 hours. Do you also breastfeed during the night? Okay, so merong mga bata, okay, na diretso ang tulog sa gabi. Others naman, they get hungry at night and they breastfeed. So it depends kung on the demand of the baby. Does the child take any other food or fluids? Okay, or puro breastfeeding lang talaga yung bata? Okay, what food and fluids, especially kapag 2 years old and above already, diba? We can have other food already aside from breast milk, actually 6 months and above. Okay, mag-iba na yung mga demands ng bata pag nakatikim na ng pagkain. How many times per day? What do you use to feed the child? breastfed ba? Bottle fed? Okay. For weight, if very low weight, how large servings? Okay. Does the child have his own serving or naghahati-hati ba sila magkakapatid? Who feeds the child and how? Okay. And during illnesses, has the child feeding changed? Okay. So humina ba yung appetite ng bata? Lumakas ba yung appetite ng bata? Okay. And feeding recommendation. So these are examples of counseling, and it is present in your IMCI. It is in the counsel, the mother chart, and we are going to discuss that tomorrow. Follow-up care is also in your IMCI. Okay, so if it is pneumonia, sasabihin dyan, when? Care for the child returns for follow-up. Okay, so nakalista dyan. Kung pneumonia, you will browse in your IMCI, return after 5 days, return after 7 days. Malaria, return after 3 days can be the instruction, depende kung ano yung nakasulat sa IMCI natin. Okay, for the summary of your IMCI, what are the steps or how do we go through the IMCI system when we have a copy of it already? Okay, it always starts with assessment. I cannot put more emphasis on this. Paulit-ulit kong sasabihin sa inyo that we are going to focus on assessment. Okay, because assessment will lead to correct classification or diagnosis, and correct diagnosis will lead to proper intervention. Okay, after assessing the child, we classify if the patient falls under purple, yellow, or green. Okay, or what illness dun sa yellow, purple, or green. Identify the treatment as listed in the classification. So each color has its own treatment na nakalista. So kung alam na natin yung treatment na ibibigay, we are going to counsel the mother. Okay, of course, we are going to do the intervention first. Then we are going to counsel the mother and the caregiver about the treatment, about the condition of the child. And of course, for follow-up checkup. Okay, when to return immediately after counseling. After counseling and we discharge the child already. Okay, we are going to return the chick child. Chest in drawing. Later, i-ano natin to. Okay, when to return the child? Immediately, if the child has difficulty breathing. Okay, kaya siya naka-lean forward. Okay, because that is the easiest way to breathe sometimes, leaning forward. Okay, so return the child immediately if the child experiences difficulty of breathing. If there is sudden fever or high fever, okay, after the treatment, isoli agad natin yung bata. Like for example, nag-38, nag-maintain ng 38, hindi bumababa yung fever, naging 39 and 40. Okay, so instruct the mother to return the child immediately in the clinic. Okay? If the child is unable to breastfeed, humihina yung appetite ng infant, okay, so return the child immediately to the health center. Okay, coughing, okay, if there are, what do you call this, if there are dati wala namang coughing, okay, tapos biglang nagkaroon na ubo yung bata and severe cough, difficult of breathing, then we should return. Chest in drawing, I will have a video for you to watch this because this is something that you have to assess also in the children. Ibig sabihin, there is difficulty of breathing and accessory muscles are already being used by the child to breathe. Okay, so when to return immediately? When the patient seems to be feeling worse or there is no progress in the condition. Vomiting and there is already diarrhea, especially if there is dysentery, pag meron ng blood sa stool. Okay, here there is red already. Okay, so yun yung mga times that you have to return immediately. Breathing poorly, feels unusually cold. Okay, so nanghihina na. Okay, in young infants, return immediately. Yellowing of the palms. Okay, so yung jaundice, okay, return immediately, especially in young infants because there is liver failure already that is happening or liver abnormalities. Okay, so that is your basic introduction to your integrated management of childhood illnesses. I will open my IMCI Okay, the PDF copy has been sent to you. So ganito ang itsura ng IMCI. It starts with your table of contents and it is divided. So first thing we have to assess is your child 2 months to 5 years old. Okay, if your child is 2 months to 5 years old, ito yung gagamitin natin, pages 1 to 40. Okay. If the child is below 2 months, newborn after up to 2 months, what part of your IMCI are you going to use? Try to increase it. Okay, so kung nakikita nyo, you have a copy of this anyway. And we call this, yeah, Victoria has a copy on hand already so she can follow. Yeah, if the child is infant, newborn up to 2 months, what part of the IMCI are we going to use? We are going to use pages 42 to 55 or the second half. Okay. Ano yung sinasabi natin kanina? Okay, so we are going to have an example. If the sick child is aged 2 months to 5 years, for example, the age of our patient is 3 years old. So the child falls under this part of the IMCI. Okay, so the first step, okay, so alam na natin yung age ng child, we know what part of the IMCI to use. Okay, we follow the steps. We are to assess and classify. Okay, so why is IMCI an idiot's guide or an instruction manual? Because even in assessment, okay, it already tells us what are the correct questions to ask. For example, in your assessment, what are the first questions to ask? For a sick child, to a mother who has a sick child of 2 months up to 5 years, ask the mother what the child's problems are. Determine if this is an initial. Okay, ito ba yung isang pasyente na pinabalik natin for follow-up? Okay, if not, okay, if it is a follow-up visit, use the treat the child chart. So the treat to child chart, okay, is in your part of your manual. But if it is an initial visit, okay, so hindi po siya follow-up child, this is a initial visit. Okay, we have to assess immediately. Ang una nating i-assess are the danger signs. Okay. Since IMCI is an instruction manual, ito na. So sinusundan natin, check for danger signs. Okay, very easy. What are the correct questions to ask? Is the child able to drink or breastfeed? So tatagalogin natin. Nakainom po ba o nakakapagdede yung bata? So 3 years old. Okay, so makaan natin ng konti, gawin nating 1 year old. Okay, para baka nagbre-breastfeed pa. So sasabihin, opo or hindi po. Okay. Does the child vomit everything? Okay, pag nagdedede ba siya, sinusuka niya lahat. Okay. Has the child had convulsions? Kinukumbulsyon po ba yung bata? Okay, so these are already some of the questions we will ask. Okay. Aside from asking application of assessment, we have to look. See if the child is lethargic or unconscious. So get the attention of the child. Clap your hands, wave your ano, tignan mo kung may gaze yung bata. Okay, yung finger mo ba sinusundan ng eyes ng bata? Okay, is the child crying and looking at you? Is the child afraid of you? Okay, is the child convulsing now as you do your assessment or as a child was brought to the hospital? Okay, if your answer to any of this question is yes, what is your classification? Urgent attention. It means that the classification of the child falls under red. Okay, red meaning any danger signs, very severe disease. Okay, nandito na. We are classifying the child under red. Give diazepam if convulsing now. Interventions are there already. Your treatment. Quickly complete the assessment. Yung head to toe mo. Give any pre-referral treatment immediately. So if there is a doctor in the clinic at may binigay siyang instructions, okay, aside from giving diazepam, you give it immediately. Assess the blood sugar, okay, because mas mabali, since this is a bata, mas mabilis siyang mag-severe yung condition niya if he is hypoglycemic. Okay, so to prevent sugar, insulin glucose may be injected to the child. Keep the child warm, balutin, then refer urgently. So this is yung flow. Assess, classify, classified under red. Okay, so aside from the purple, yellow, and green, we have our red. Sorry, I forgot to mention that. Okay, and these are the things that we have to do. Okay. A child with any danger signs needs urgent attention, complete assessment, and any referral treatment immediately. So referral is not delayed. Okay, so ganun yung magiging flow while using your IMCI system. Assess, classify, and treatment. It is all written in your IMCI manual. What if no tayo dito? So no naman, hindi naman siya nahihirapang mag-breastfeed, hindi nag-vomit, okay, walang convulsion. So our classification basically is we don't need, the patient doesn't fall under red. It's a manual, so we simply just go to the next page. Okay, flip to the next page of your manual. Since no danger signs are present, okay, then ask about the main symptoms. Okay, so na-figure out ko na. It can be the color chart or something, but basically this is red or purple pala. Okay, so purple, red, yellow, and green. So yung sa lecture natin kanina was, what do you call this? The different colors were purple to yellow to green. Okay, so dito pala ito na yung purple niya or maroon. Okay, so basta the top part. Okay, so it tells us already what are we going to assess next kung wala siyang danger signs. Ask about main symptoms. So what are the main symptoms? Number one is cough or difficulty breathing. Okay, does your child have cough or difficulty breathing? If the mother says yes, assess how long. For how long? Okay, so how many weeks, etc. Okay, so prolonged cough. Okay, look, listen, and feel breaths per minute. Look for chest indrawing. We will assess that tomorrow. Stridor. Okay, the difference of stridor and wheezing. You look for wheezing as well, and the child must be calm. Okay, if there are wheezing, fast breath, chest indrawing, give a triad of bronchodilator 3 times 15 to 20 minutes count the breaths. Okay, so if the child is 2 months to 12 months, fast breathing is 50 breath and above. Okay, the standards here are based on IMCI standards. So meron tayong classroom standards. Different books can give different standards for normal breathing rate. Okay, pero ito IMCI rates to. 50 and up is fast breathing for 2 months to 12 months. 12 months to 5 years, okay, 40 breaths per minute or more. Okay, so then we classify as cough or difficulty in breathing. Okay, so how do we know what color will the patient fall on? If there are any danger signs and stridor in a calm child, the classification is severe pneumonia or very severe disease. Okay, so this is the classification of a child. Then what are the interventions? Give first dose of antibiotic, refer urgently to the hospital. Okay, so kung wala namang danger sign or stridor in the child, but we notice chest indrawing and fast breathing, okay, our classification falls under yellow. The patient has pneumonia, and then the interventions are here. Okay, give oral amoxicillin for 5 days. Okay, if wheezing has disappeared, give inhaled bronchodilator for 5 days. So ito yung mga interventions na ibibigay natin. If chest indrawing in HIV patient, so I will ignore that. Okay, soothe the throat and relieve cough. Ma'am, ano po yung mga pwede nyo gawin sa bahay, okay, para mag-lessen yung swelling and pain dun sa throat na anak nyo? Warm water, calamansi juice, for example, iwas sa mga sweets. Yan mga intervention natin. If coughing for more than 14 days, okay, refer for possible TB or asthma assessment. Advise mother when to return immediately. There will be a list, okay, when the patient will return immediately or follow up in 3 days. Okay, so ito yung mga interventions natin based on our IMCI. Lastly, what if the patient doesn't have any danger signs? Walang stridor, there is no chest indrawing, there is no fast breathing, okay? And there are no signs of pneumonia or very severe disease. It is just a normal cough and cold. So how do we classify that? The patient falls into green. And what are the interventions? Okay? If wheezing disappears after the bronchodilator, okay, continue your bronchodilator for 5 days. Soothe the throat with home remedies. Okay, so lozenges siguro, okay, luya, okay, mag-gargle ng water with vinegar, salt and vinegar. Okay, if coughing for more than 40 days, recurrent wheezing, refer for possible TB or asthma assessment. Advise mother when to return immediately. It is on the list that we will discuss tomorrow, another part of your IMCI. And follow up in 5 days. Okay, so are we done? Not yet, because again, this is a manual, a flow chart. not because walang cough, yung patient natin is wala na siyang sakit. Okay, so what if the patient doesn't fall in any of these categories, walang cough, walang etc. I'm going to assess for diarrhea. Okay, so the patient can have cough and not have diarrhea. Okay, so we are going to assess for diarrhea. How long is the diarrhea? Is there blood in stool? O ma'am, meron po bang blood sa pupo? Okay, so do you see red? Okay, assess for lethargy, unconsciousness, etc. So that is your class. For diarrhea, look for sunken eyes. We will have videos on sunken eyes tomorrow. Pinch the abdomen. We are looking now for dehydration. So we are going to classify now. Okay, dehydration. It can either be severe dehydration, some dehydration, no dehydration. What are the signs for severe dehydration? Lethargic, unconscious, sunken eyes, not able to drink or drinking poorly. Pinch goes back slowly. So ibig sabihin may severe dehydration yung bata. These are the interventions. Oresol, if you can give IV fluids, give it. Okay? Urgently rush to the hospital kasi doon siya isuswero, probably. If these are not present but the patient is restless, irritable, sunken eyes, drinks eagerly or thirsty, okay, so our classification is yellow. The patient has some dehydration. Andito naman yung mga interventions natin. Zinc supplements to stop the viral or to control the viral or bacterial infection. Plan B, makikita nyo later. There are different plans also dun sa different parts ng IMCI natin. Not enough signs to classify. There are no dehydrations. Based on the assessment, wala. Wala siyang maganda yung skin count niya. Ay walang yung skin return niya. Not restless, irritable. Okay, so there is no dehydration. Lagyan lang natin ng zinc supplements and vitamins. Assessment, if the diarrhea is 14 days or more, yes, dehydration is present. Ganun ulit, go to the hospital, yellow, a treatment in the rural health center, then send home, then follow up after 5 days. Okay, so basically, nagigets niya na kung paano yung sistema ng IMCI natin. Okay, after assessing for diarrhea, kung walang diarrhea, meron bang fever? Again, what are the next questions again? Okay, and what can be classified if there is malaria, no malaria, measles, dengue. Okay, so of assessment, ask, look, and feel. Okay, what are the questions to ask? After fever, we check for ear problem. Then we classify the ear problem. Is there ear pain? None. Is there discharge? None. Okay, pag wala, we go to the next question. But if there is there ear pain? Yes, umiiyak siya kapag tinatamaan. There is guarding behavior. The child is always covering the ear. Okay, is there pus? Yes. Okay, so ano gagawin natin? Classify it as an ear problem. Mastocytitis, acute ear infection, depende sa mga assessments na listed in your IMCI. Then, what are the interventions if the patient falls under pink, yellow, or green? Okay, so that is how you use your IMCI. Malnutrition, walang ear infection, check for malnutrition. What is the nutritional status? So, pansinin nyo, from the beginning up to here, almost half ng IMCI, bawat page, it is all about assessment. Not able to feel the RUTF, there is a breastfeeding problem, MUAC less than 115, weight for height, weight for length, yan yung mga kailangan i-assess. So from the pinaka-left part up to the middle, so almost 50% of the page focuses on assessment. And wrong assessment, okay, after, what do you call this? After malnutrition, we check for anemia. Okay, so dito pa lang, kung mali na yung assessment natin, if we're not able to assess palmar pallor, yellowing, okay, we might be giving the wrong diagnosis or wrong classification. Thus, we are going to implement wrong instructions or wrong treatment. Okay, so from assessment is the very critical stage for you second years. Okay, after HIV infection. So ito yung mga gusto ko na skip kasi hindi ganong applicable sa atin. Okay. Also, after checking for HIV, immunization status are there. We will review this tomorrow. What are the medications or what do you call this, immunizations according to the vaccine schedule, including deworming, vitamin A supplements, and oral health, dental checkups, HIV testing, Hep B results. So yan. So that is basically how your IMCI works, and we will go through the whole manual tomorrow. Slowly, I am introducing you to how the IMCI, but you go back to what Sir Erwin again wants to put emphasis on. Letter A, ADPI assessment. From the pinaka-left up to the middle, it's all about assessment. So what are we going to do about that? Okay, stop screen share. Okay, so what are we going to do tomorrow? November 5, 2021, tomorrow, IMCI duty, day 2, level 2. Okay, so it will start tomorrow at 8 a.m. Look at our initial activity for tomorrow. Okay, there will be reporting on nursing assessment. Okay, so I want, as I told you, I will be facilitating your IMCI duty. It is not all teaching. So that is a difference of your RLE. So from your theories, this is part of your RLE or related learning experience. So I will not just be here talking and talking. So in terms of nursing assessment, you will be the ones to discuss the nursing assessment. Okay, so napansin nyo kanina sa IMCI, ang dami natin kailangang i-assess, from breathing to fever, to ear infections, to anemia, pallor, jaundice, etc. Okay, so head-to-toe assessment, etc., etc. So 8 to 10 a.m. tomorrow will be your nursing assessment. So each of you or everybody will prepare a slideshow presentation, a PowerPoint presentation on nursing assessment. The topics will be given later. Okay, so after the assessment, okay, the flow is we will focus on nursing assessment. Bakit kayo ang pinagtuturo ko ng assessment? Okay, because if I teach the assessment, okay, it's going to be a plain lecture. But if you are the ones who are going to discuss the assessment, mas matatatak sa utak nyo. So if I talk about respiratory assessment, okay, so this is something that I reported under Sir Erwin Gonzalez. So I want, alam ko what stridor means, alam ko what is the breathing pattern, what are different breathing patterns, what is the breathing rate. Okay, so na-memorize ko yan kasi ni-report ko yan kay Sir Gonzalez. Okay, the application is easier if you are the ones who are teaching it. Okay, because the concepts are in your head already and this is RLE. So kayo ang magtuturo ng assessment, depende mamaya sa mga topics na ibibigay ko sa inyo. Okay, next, after the reporting assessment, application of the nursing assessment. So magkakaroon tayo ng IMCI lecture with the application of your assessment. Actually, naka-merge na to eh. As you are discussing, okay, as you are discussing the assessment, we will be having an application, okay, application of the assessment. Sorry. Okay, so kasi already nga, so isasabay natin yan. As you are assessing, I will tell you where to use the things that you are reporting. Okay, yun ang gagawin natin. So diretso yan. So kanina we kept on having breaks. Tomorrow halos walang break. Okay, because it will be using the IMCI already and focusing on a lot of assessment. Then we are going to have our break. Then we are going to use already your IMCI manual using what do you call this, sample problems and sample videos. Okay, and it's also those sample videos na gagamitin natin as simulation for your actual patients for your day 3 of your IMCI duty. And you're going to tell your sample problems and your post-test. Okay, kung meron tayong post-test, pre-test, meron tayong post-test. And I hope that everybody has submitted already the post-test dun sa group chat natin. Okay, so going back, preparation for reporting on nursing assessment. Okay, kayo ang magre-report ng nursing assessment. And what are the topics? Okay, so the group members, Jelly and Shane, I would like you to make a PowerPoint presentation on respiratory assessment. Okay, what part of respiratory assessment? Normal assessment lang. Focus on normal values. What are the normal breathing patterns? What are the normal breathing sounds? Okay, how are the normal breathing sounds assessed? Okay, especially in adult. Okay, usually adult ang ginagamit yung baseline eh. But remember, IMCI is 5 years old and below. Okay, so how do we assess? What is the normal appearance, normal breathing pattern, normal appearance of a child who has normal respiratory assessment? Okay, so Jelly and Shane, do you have questions regarding what you are going to report? Are you there? O nga pala, there are only 8 students here. Nasaan yung mga iba? Do I mark them absent? Jelly and Shane, parehong wala, ano? Am I correct? Who is the group leader again here? Who is the group leader? Bakit hindi kayo mag-unmute? Jelly and Shane. Sino si Jelly? If I go to my class list, okay, Jelly is Christine Jelly Almeron. Is she not included in this group? Unmute. I don't want you to type. We're having a conversation here. Wala ba? Hindi nyo kasama? Because on my class list for November 4 and 5, the students should be Christine Almeron, Shane Kamani, Amira Chan, Julene Damong, Jermaine De La Vega, Jewel Emok, Mika Javier, Janice Peg-Ed, Afro Allen Sabiit, Pauline Ulalim, and Winard Villanueva. So that's 2, 4, 6, 8, 10, 11 students. Okay.
Sir,
So,
wala po silang dalawa.
Sino ang wala?
Si Almeron Kamani.
Almeron and Kamani. So I will adjust going up. Okay, so adjust natin yung reporting. Okay, so yan ang magiging grouping. Okay, so Amira will be reporting on respiratory assessment. Amira, is this okay with you? Normals naman yan, so hindi ka naman mahirapan dyan.
Yes, sir.
Okay,
Sir, si
Victoria.
Maika din po.
Maika.
Wala rin po Maika.
Maika Javier. So wala siya? Wala talaga siya sa ano nyo? Ever
Wala
since?
po dito. Minsan lang po.
Minsan lang siya pumapasok. So pati sa klase nyo, hindi siya pumapasok?
Minsan din po pumapasok.
Okay, so group leader, try to get in touch with the 3 students. If possible, si Christine, si Almeron, si Kamani, and si Javier Maika. Okay, so follow up. Tanong mo kung bakit wala sila dun sa dito sa IMCI natin. Baka hindi nila alam. Okay, but either way, they are absent for today. Okay, so try to get in touch. What do you call this? Victoria. Okay, so according to my list given by Ma'am Nasper, there should be 11. Okay, 11 students. Okay, so Almeron, Kamani, Chan, Damong, De La Vega, Emok, Javier, Pag-Ed, Sabit, Ilalim, Villanueva. Okay, so ito dapat yung mga individuals na under the group leader. So try to follow up kung kasama sila sa ibang klase nyo, ask bakit hindi sila nakasama or hindi ba nila alam na may duty kayo. Okay, so kung wala si Maika, okay, so that is normals. No, hindi na normals to eh. Ayan. Okay, so just in case. Pero just in case, okay, so meron siya, patulong ka. Kung wala, okay, so you will have to do it on your own. Okay, so Julene and Jermaine, respiratory assessment, we will talk about abnormals. Okay, so very important. Okay, what are the abnormal findings? Anything that deviates from normal is abnormal. So what are the abnormal breath sounds, abnormal breathing patterns, abnormal appearance of breathing, signs and symptoms, values, indication of abnormal assessment. Ano ibig sabihin kapag meron ng chest indrawing? Okay, ano ibig sabihin pag may wheezing? Okay, so all of those you should be able to discuss. Okay, like narrowing of the bronchioles in asthma, etc., etc. If there is wheezing, increase in secretions, Okay, so try to discuss that, Jeline and Jermaine. Is it clear?
Yes, sir.
Okay, so any questions, let me know. Head-to-toe assessment, second years. This is a topic, I don't know kung na-discuss na sa inyo, pero this is a second year topic. Head-to-toe assessment. Okay, general status, head, ears, eyes, throat, neck, cardiac, pulses, extremities, neurological. Okay, so kasama na dyan yung seizuring. Okay. Jewel, can you do this on your own? Because this is already normals and abnormals. Pero I want you to focus lang on specifics. Head to toes, madami, pero hindi lahat because I want you to focus on head, ears, eyes, throat, neck, cardiac, and pulses, extremities, and neurological lang. Okay, so hindi lahat, hindi naman head to toe assessment na buo. Okay, but these are the general topics. Can you do this on your own or gusto mo ng partner?
Okay lang.
Hindi ko marinig. Jewel, di ko marinig. Will you be able to do this on your own? Okay, for fever and dehydration. Okay, so Janice and Afrulin, fever and dehydration. Skin appearance and temperature. Yeah. Medyo madali. Lipat kita dito sa taas, Janice. Masyado madali yung yung fever and dehydration. Okay. Okay, so Afro, fever and dehydration. What is fever? Okay, and the signs and symptoms of dehydration already. So this also falls under input and output when you talk about dehydration. Feeding patterns, normal na breastfeed dapat ng bata, ng infant. Normal amount of urine within an hour, 2 hours, etc. Okay, so signs and symptoms, normal output ng pupu, piwi, okay. What is hyperemesis, increased GI motility, etc. etc. So, Afro, mas madali to. Kaya mo mag-isa to? Miss Sabit? Can you do this on your own? Ako, I cannot hear you, so I'll take that as a yes. Pauline and Winard, nutritional assessment. Okay, so nutritional assessment and vaccinations, 2 topics. So I'm giving 2 people in that group. Height and weight, okay, proper height and weight, nutritional screening. What can you use to test nutritional screening? And vaccination. It means what are the vaccines, what are the specific schedules. Okay, so madali lang yung topic pero dalawa. So I'm giving 2 people in that group. Okay. So again, the reporting, especially of the respiratory assessment, kayo mauuna. Okay, so Amira, Julene, Jermaine, you will be the first ones to report tomorrow. So I want this report done and prepared by 8 a.m. So marami kayong resources, internet. Okay, so stick to essentials, stick to fundamentals. Okay, tapos, ayan, Amira, normals lang. Tapos try to elaborate on the normals. Julene and Jermaine, abnormals. Explain also, okay, what are the abnormal values. Breathing patterns. If you have photos, breathing sounds na ma-download, better. Okay, pictures of waves, kung ano yung dapat, ano yung gap. Okay, so try to download data to add in your PowerPoint presentation tomorrow. Head-to-toe assessment, general status. Okay, kasi yun yung mga tinitig natin sa bata. Okay, especially sa head. Okay, so appropriate pa yung head size. Ear infections we saw already earlier. Okay, so what are the appearance of ear infection? What to assess? Okay, eyes, are the eyes perla? Throat also, tapos neck. Cardiac, extremities. Okay, neurological, especially regarding seizure. Okay, fever and dehydration. When we talk about skin temperature, so probably even jaundice falls under you if there is yellowing of the palms, etc. So what are the normal appearance of the skin? What is abnormal? And Pauline and Winard, height to weight, age to weight, yan yung mga i-discuss nyo. Nutritional screening, how to assess. Anemia also falls under you. Okay, and vaccination. Okay, so do we have any questions so far? Hindi na pala kasama to sa recording dapat. Okay, so, yeah, end.